in the questioning and recognize myself for 5 minutes. It is interesting when we talk about the takings clause because we argued this a number of times in this committee and in the full committee and in the health committee. And in the last hearing that we had in the Energy and Commerce full committee, I looked over to my colleagues. We were in the minority then, so I looked this way. I looked over to my colleagues on the Democrat side of the aisle and I said, if I'm wrong on the Constitution, somebody please bring me a case that shows that I'm wrong. Still waiting on the case. Now, I will also reference that in the British Army of the 1700s, rank and file soldiers often just stole what they needed. But even before the American Revolution, British officers, in the name of the king, would negotiate with a merchant or a farmer. The officer would offer what he thought was fair. If you refused his offer, so be it. He would just take what he needed. They negotiated before they took it. America wanted to be better. Now, I'm personally not against negotiation, but my friend, and I hope we can be friends even though we disagree, Dr. Kesselheim just raised a great example. I'm on Xarelto. I'm eligible for Medicare. I'm not on it yet. Eliquis is the competing drug. There are two medicines that solve the same medical problem. Real negotiation, which I'm not against, would say that we put the test to them and say, which one of you can provide Medicare with this drug that is truly transformational for people with blood clotting issues? But both of them work. So why not negotiate and say, bring me your lowest price? That's real negotiation, not what we currently have. Dr. Potts, talking about this 95% excise tax on the gross receipts, would you invest in a company where a product had the chance to be taxed more than the gross sales of the product would produce in revenues?
Yeah, I mean, think about it from the...
And if you could pull your mic closer to you, and if all of you could make sure, we heard Mr. Crowley and Dr. Kesselheim fine, but if Mr. Shortaki and you, Dr. Potts, could pull the mics a little closer so we can get more volume.
Sure, thank you. Think of that question from the point of view of an investor. And you're sitting, I say Shark Tank for nerds, you're sitting and thinking about investing in biotech or something else, and you say, look, you got a 1 in 20 shot of having the drug after it is first in human trials get approved. And you have a very low chance of even getting it to human trials. I've shut down a company, didn't make it that far. And then after that, you're gonna say in 7 years from that point, you work so hard, the odds are so low. In 7 years, you're gonna negotiate, you start the negotiation period. If you don't comply perfectly, 96% of your total sales, which we don't even see, not profit, sales could be eventually taxed. I mean, you can see why it's so hard right now to raise funding for small molecules for the elderly.
So your answer is you would not invest.
We're seeing it. 6 out of 7 VCs have said, we're going to make changes based on this.
Mr. Crowley,
small molecules.
Would you invest?
It makes investment much more difficult and much more challenging, for sure. It presents another barrier to innovation. And I think that's important to realize that investors are an important part of this ecosystem.
And because of the love of your children, you probably would have done the same thing today that you did then if you could change their lives. But as an investor on the sidelines, you wouldn't probably invest it. Is that correct?
It would make it much less likely, yes.
Yep. Countries like China and India have explicitly stated they want to become global leaders in medical innovation. I'm worried the drug price negotiation program will help make these countries more attractive for R&D and manufacturing investments than in the U.S. And of course, Europe has always been out there. Dr. Potts, are you seeing some of the companies starting to look to Europe to be where they do their innovation, or to China or India?
When I started my career, Europe and the U.S. were about the same. Because of the Hatch-Waxman and the patent protection we put in place, the U.S. really pulled ahead. I'm very worried about China. I mean, you don't see China, basically slandering their biotech industry like what you see so typical across this United States. So yes, we are worried about it.
And they don't have to worry about investors because they have the Chinese Communist Party. Dr. Potts, on that as well, and Mr. Crowder, you believe that our leadership role is in jeopardy? And I think the answer is yes. Yes or no? Because my time's running out.
Yes, very much.
Okay.
Yes.
And Mr. Crowley, can you please explain how companies pursue new uses for older drugs, particularly cancer, and how the provisions of the Inflation Reduction Act allow the so-called negotiations to start at 9 years for small molecule drugs and 13 years for biologicals, and how that will hinder the research there?
I think it's important to realize, Chairman, that, when we're in our companies or in academia, we start with a disease, and we think about what are the best technologies to tackle that disease. We don't do these health economic analyses. It starts with the science, and we follow the science. What the IRA does with respect to 9 versus 13 years is to provide a bias for people looking at these programs, what they're going to cost and what the return would be, all the capital it takes. And when you look over that time, it's going to be biased against small molecules. And small molecules are incredibly important. As Dr. Pocht said, it's 90% of new drugs are small molecules.
I'm running out of time. Lastly, if you would just raise your hand, if any of you have been advising or in talks with CMS or HHS on the implementation of the provision in the Inflation Reduction Act. Seeing nobody has been involved in that? Just raise your hand if you have been, because I'm out of time. All right, seeing none, I will now yield